There's so much to think about when you're having a baby. New moms have to worry about what to eat, how to prepare, the changes in their bodies, and so much more, all before their child is even born. It's easy to become overwhelmed. In this video, we'll show the basics when it comes to staying healthy during your pregnancy. We'll explain why an active, nutritious lifestyle is vital not only for you, but for your baby too. And we'll also touch on some things that you shouldn't be doing while you're pregnant. The key to delivering a healthy newborn is regular prenatal care. So first things first, see your doctor if you think you might be pregnant. If you're healthy and there are no expected complications, you can expect to see your doctor every 4 weeks until the 28th week of pregnancy, then every 2 weeks until the 36th week of pregnancy, and then once a week until you deliver. Throughout your pregnancy, your doctor will check your blood pressure, weight, and the growth and development of your baby. You'll also have at least one ultrasound. This can be one of the most exciting parts of your pregnancy because this will give you a first look at your baby. Throughout your pregnancy, it's important for you to maintain a healthy diet. As the old saying goes, you're now eating for two, or even more. So it's important that you eat healthy foods. Things like lean meats, fruits, vegetables, whole grain breads, and low-fat dairy products are just what your baby needs for proper development. It's also important to note that you will gain weight during your pregnancy. That said, this is not the time to diet. In fact, depending on your size, you may need to add a few hundred calories to your daily diet. Talk to your doctor about what's the right amount of food for your body type. Along with healthy foods, vitamins and supplements are essential. Calcium, iron, and folic acid are 3 essential things your body needs during pregnancy. There are lots of foods out there to help you get the recommended vitamins and minerals, but your doctor may recommend a prenatal vitamin to help eliminate the guesswork out of deciding what your baby needs. Drinking plenty of fluids, especially water, is very important during pregnancy. When you're pregnant, your blood volume increases, and drinking enough water can help prevent problems like dehydration and constipation. The 2005 U.S. Dietary Guidelines recommend that pregnant women get at least 30 minutes of moderate exercise each day. Regular exercise has been shown to help with things like preventing excess weight gain, reducing complications including back pain, swelling, and constipation, improving sleep, preparing for labor, and lessening recovery time. If you were a regular exerciser before becoming pregnant, talk to your doctor about whether it's safe to continue your normal activities. If you're just starting out, activities like walking, swimming, yoga, or Pilates are great options for you to keep active while you're pregnant. As an expectant mother, it's also very important that you get plenty of rest. Remember, your body is working in high gear to support another life, so you'll probably feel much more tired and exhausted than usual. And as your baby gets bigger, it's going to get more and more difficult to find a comfortable position to sleep in. Most doctors recommend lying with your knees bent on your left side. Because your liver is on the right side, lying on your left side keeps the uterus off the liver. Ask your doctor what they recommend. In most cases, though, either side is perfectly acceptable. And for even more comfort, use a pillow between your legs, behind your back, and underneath your belly. Now that we've explored things you should do when you're pregnant, it's important to touch on some things that you shouldn't do. First, alcohol is off limits. It may seem harmless to enjoy an occasional glass of wine or pint of beer, but alcohol can cause mental and physical birth defects. If you're a smoker, now's the time to quit. Smoking while pregnant can cause countless complications like stillbirth, prematurity, low birth weight, asthma, and other respiratory problems. Caffeine can also have adverse effects on your pregnancy. High caffeine consumption has been linked to an increased risk of miscarriage. If you're a coffee drinker, switch to decaf or cut down to just 1 or 2 cups a day. Be careful about over-the-counter and prescription medications. Even simple cold medicine can have an adverse effect on your baby. Always ask your doctor before taking medications or before using prescription drugs prescribed to you before you became pregnant. You also need to watch out for certain foods, which could lead to foodborne illnesses. Avoid soft, unpasteurized cheeses, unpasteurized milk, juices, and apple cider. foods that contain raw eggs, raw or undercooked meats, and processed meats like hot dogs and deli meats. There's a lot to remember and to be careful of during your pregnancy, and it may seem a bit overwhelming at times, but it will all pay off in a few months as you embark on an exciting journey with your new, healthy, and happy family.